So I am quite happy to see our Kakinada students and 30 plus online viewers with many hundreds more in the classrooms. So doctor, at least until 150th question we will discuss, remaining last 50 you can review in the explanatory booklet. Now 3.5-month-old systolic thrill, holosystolic murmur, mid-diastolic rumble, what is your diagnosis? Huh? What is the only perplexing auscultatory finding in this? That is expected of VSD. To call VSD something else is worrying. Mid-diastolic rumble is worrying actually. So what happens in the case of VSD? Left to right shunter. That means right receives regular blood and also shunted blood. So too much blood. Your homework, your sister's homework, together you need to do. Okay, you have done. Where will all that extra blood shunted from left to right will go into? Pulmonary circulation. Once more all that will return back to? It will return, there is no return back, return, okay. It will return to left side. So ultimately when blood is passing from left atrium into left ventricle, there is increased blood flow against the normal mitral valve. Normal flow against abnormal valve or abnormal flow against a normal valve. Anything can lead to rumble. So that mid-diastolic rumble is explained by increased flow against the across the mitral valve in case of a left to right shunt is what need to be remembered. 3-day-old infant, when is he more likely to benefit from a platelet transfusion? What is your answer? Why do you give platelet transfusion? Basically to avoid intracranial hemorrhage. But how long will those platelets which you have infused will be living inside the body? Don't tell 10 days. Infused, not more than 2 days.
5 days.
You might have seen lot of dengue fever cases, ITP cases. If you give platelet transfusion, for every packet of PRP, 10,000 count will increase. By next day, once more it will fall down. It is only a temporary maneuver. In fact, in ITP, if you over jealously give platelets, what will happen? ITP is due to antibodies, auto antibodies against one's own platelets. If you keep giving more and more platelets, you are making the immune system become more and more angry. You are stimulating more and more auto antibodies. In fact, you will be worsening the condition. So in ITP, unless it is an emergency, don't do. Unless there is a bleeding, don't do. Platelet transfusion is very important rule. So doctor, in this case, the ventilator for severe respiratory distress, if he is there, then he is at a risk of intracranial hemorrhage, and for such people you need to give the platelet transfusion is what need to be remembered. Now spleen is enlarged, CVP is normal, how you want to basically evaluate? It is the abdominal ultrasound is the best investigation in this given clinical scenario without any radiation issues. ALL has WBC count of 1 lakh. You have given induction therapy that led to increased creatinine. Previous question, yeah. Yes, the best next test. Abdominal, 10-year-old who is asymptomatic, splenic edge is palpable 3 centimeter clinically, right? So first you do a CT ultrasound to find next test, best next test. Best is there, next is there, no? Is it there in the text given to you? No, it's not there in the question paper. Print mein hoga. Yeah. There is no autophagocytosis of the sentences in our question paper. Already because of the typing errors we are suffering some problems. On the top, if the words keep dropping themselves, I am more worried. So, yeah, ALL, WBC count 1 lakh, creatinine elevated. What is your answer?
Tumor lysis.
One question on tumor lysis syndrome, doctor. All what happens to phosphate, calcium, potassium, you must be sure. Huh? Now, precocious puberty, how will you basically treat?
GnRH.
So what will you do with GnRH? You want to stimulate? Continuous administration will inhibit the pulsatile release which is occurring prematurely. Now one short quiz, doctor, another disgusting question on the bursa. You can check your own ulnar bursa and answer this. Ulnar bursa contains the tendons of what? Which tendon? A is one answer, I am listening. Asha? C? D. Teja is proposing D. Any other answer? D. Looks convincing. Unless there is something else which is fishy. If it is fishy only we will give MCQ. No, that is wrong. All MCQs are not set in a fishy manner. If you don't read and go to exam, everything looks fishy. It's you who is wrongly responding. So, doctor, ulnar bursa is a common flexor synovial sheath for both flexor digitorum superficialis and also for profundus together is what you need to ultimately remember, doctor. What is wrong about leprosy?
A.
Is it repeated?
Last paper.
Oh, but these questions, no. Some questions came in the previous paper. Okay. Dermatophytosis, what is your answer?
C.
That's right. C, that's right. Central clearing is a feature. If mucosal involvement is there, that is no more dermatophytes. You can't say tinea and send away candidiasis patient. So you need to be quite sure about how each of it will behave. How many days is house surgeonship में nowadays dermatology posting? नहीं है?
15 days.
Personal skin problems आए तो कहाँ जाना? So 15 days no? Sankranti will come during that time only, Pongal. Huh? Before Pongal 5 days, after Pongal 5 days, during Pongal 5 days. Dermatology is over. Huh? So minimum guarantee you need to give is to treat fungal infection of your own roommate for your personal protection is the minimum thing you need to pray God before going to dermatology, that 15 days posting. And let me tell you, if you know how to treat fungal infections in this country, MBBS degree is sufficient to survive. 100 rupees for every itchy inguinal area is what you can put a board. Raju MBBS, right? So we cure you for all the inguinal itch, because fungal infections are very common in a tropical country like India. Now lichen planus,
C.
what's your answer, doctor?
C.
It is a flexor, not the extensor surfaces. What are the 4 P's? Pleuritic, papular, purplish, polygonal lesions is the lichen planus is what need to be remembered. Plaque psoriasis, what do you want to say?
D.
D.
So basically they can evolve the acute flare-ups into erythrodermic form. Antidesmoglein, vulgaris, bullous pemphigoid. Minimum guarantee topic in dermatology. Let me tell you, dermatology is much easier to master because not even 30 topics, read only 15 topics in dermatology in the top list I have given. Still you are not getting a suicidal depression means you are a good candidate. If you aim entire dermatology to read, very difficult, right? At least top 15 precisely you must remember. Elderly people may bullous or pemphigus. Bullous pemphigoid is more common. Similarly, which is flaccid, which is bullous, and which is associated with internal malignancy between bullous and which is intracellular, everything, all differences you should know. Now doctor, give an answer for this quiz question. Pisiform bone, what is except about it? Give an answer. Pisiform bone.
C.
Online students, please punch your answers. We are very much watching you. Rupa, students of Kakinada, Matthews, yeah.
C.
C you want to say confidently? Beautiful, beautiful. Tender of extensor carpi ulnaris, you yourself can check. It will have attachment to the base of the fifth metacarpal. Whereas extensor carpi ulnaris, flexor carpi ulnaris is attached to the pisiform. Okay, doc. Now, what is the absolute contraindication for neuraxial block?
Except.
Past 2-3 weeks we are worrying about this. You like to say? Absolute means absolute only. Huh? You like to say raised ICT? Except.
Patient on aspirin. Except, sir.
Patient on aspirin is what, doctor? It's a relative contraindication, not absolute. So this list, doctor, it will be haunting you in the exam hall. Trigger finger के लिए you want to give intravenous regional anesthesia.
B. Bupivacaine.
Which one you don't want to give?
Bupivacaine.
Straight you can stop the heart. If you give intravenously the Bayer's technique, Bayer's block may bupivacaine. Now, Tohi's needle, where do you use? Basically for epidural analgesia. MAC is highest in. Today only you should read factors affecting MAC, increasing MAC, decreasing MAC. Simple things every day if you can correct, doctor, you will become a star student, let me tell you. You don't need to do big wonders. Just to keep 5-6 topics every day. You will become big. Even tomorrow when you do MD, keep some 80 to 100 expected diagnosis you are going to make in 3 years. How to diagnose a simple SLE, simple rheumatoid arthritis, and to not confuse for osteoarthritis. When to give steroid, when to not give steroid. 30-40 decisions, 80 to 90 diagnosis. If you can thoroughly practice on your 3 years, you are a top clinician ultimately. So also for entrance preparation also, you don't get time also. 5-6 topics पक्का पढ़ो और जाओ. 50 days पढ़ लिए तो 300 topics खत्म करते. Exam ultimately is the game within that. Exam is not a test of knowledge. So you need to be quite sure. Nitrous oxide MAC is 104%. Right, doctor? Now let's go to the next question. Isoflurane.
B.
What do you like to say?
B.
B.
The speciality of the isoflurane is it can cause coronary steal phenomena. That's why we kept it as one of the options to confuse you. If you apply reasoning in anesthesia, you are bound to fail. It causes coronary steal phenomena, because of that heart attack will come, because of that cardiac output will decrease. If you start thinking like that, you will jarur jayega graveyard mein. So you should not. You are known to know the fact, that's all, unfortunately. Okay, shoot an answer, doctor. How these pass through the anatomical snuff box you can palpate, except palpate yourself and tell.
Lunate.
Huh?
Lunate.
What? Lunate. Anybody said scapoid? No? Yeah. Lunate. Excellent. Rapid cycling, when will you call, doctor, in bipolar disorder? More than?
4.
You are all so precise. Don't look at key. Give your honest cycling answer. What you thought. That helps others to remember. Your wrong answers will make us to remember better.
Polyuria.
Which is not, which is a side effect?
Polyuria.
Polyuria.
So you find weight gain, not loss, leukocytosis, not penia, and polyuria and polydipsia. 28-year-old accountant doctor. So basically you must know, she denies any suicidal thoughts. She denies any episodes of hopelessness or impaired sleep pattern.
Dysthymia.
So that makes it dysthymia. Dysthymia. So DSM-4 criteria, nowadays DSM-5 is going on. So if you don't get seat quickly, 6 also will come. So long-term treatment of panic disorder, how do you want to treat?
SSRI.
SSRI.
Commonly we prescribe to the patients SSRIs. Only acutely to manage anxiety you will give benzodiazepines, not for long term. But what is the wrong reasoning in the exam hall? Alprazolam regularly our aunt is taking, no. So maybe she is anxious about me, will I get seat or not? Maybe long term may benzodiazepines, because you know that what alprazolam basically contain. So there can be few wrong assumptions. Okay doctor, you give an answer for this. First of all, do you know difference between obsessive compulsive disorder एक होता है, obsessive compulsive personality एक होता है, दोनों के बीच में क्या फर्क है डॉक्टर? What is the difference between the two?
Insight present.
Few boys are confused right from birth. Few boys are confused after falling in love. So if something comes to you in the middle of your life, that is a disorder. If it comes right from your childhood, it becomes the personality. Right doctor? So tell me, personality disorder and obsessive compulsive disorder as such, what is the difference? Fundamentally, which is ego dystonic, which is ego synthetic, where is the insight, where is no insight is important. Some of our professors are very panicky and angry. For no reason they will be angry, they will be throwing out everything, entire ward will be a drama in the morning. In some finer moment, you just sit on his side and say, sir, you are excellent teacher, and why sir you will get panicked? He will say, where I got panicked? I never panic. That is the normal way of me. If he says, what is the problem he is having? Personality disorder. He doesn't even know that he panics, he shouts, he runs around amok, holding a knife in the ward. Here and there, as such, he is ready to sabotage your peace. But if the professor says, I am really sorry, you are taking your MD degree, you are leaving, all the 3 years I have really made your life miserable. I always used to regret, but I don't know, I become like that in work. If the professor says, what he is suffering? Obsessive compulsive disorder. Of course, after joining post-graduation, first 2 weeks is you must diagnose between the two. To which category HOD belongs to. Accordingly, you need to match his preferences. So that's important.
Sir, D option.
D, yes, patients lacking insight. In case of personality disorders, patients lack insight. Right? So that's the truth. Lack insight. But in obsessive compulsive disorder, they have an insight. Patient will call you 10 times. Doctor, can I take this tablet, doctor? Yeah, you can take it. Doctor, 9 o'clock shall I take? 9:30 p.m. I shall take. Any time is okay until 10 o'clock you will tell. Fine, doctor. Doctor, before eating shall I take? After eating I shall take. You will be thinking, why I did DM nephrology? Ultimately, yeah. But you need to tell patiently, because nuns, doctors are not supposed to have a limbic system or anger. That's what society expects from us. So you must tell. That's the reason best thing to tell is, any time you remember it, you can take it. is a better thing. And sometimes you need to tell patient, you may forget your wife also, but don't forget to take this tablet. Few things so that patient is thoroughly convinced. Now doctor, give me one confident answer. Nail bed of the index finger. It's like a Chandamama riddle. You like to say? Some are saying median, some are saying radial. Teja, what is your judgment? Radial. Asha? Ramakrishna?
Median.
Oh. Give one loud clap to Ramakrishna's confident. Let me listen doctor. अरे ताली के बिना मजा क्या है शाम गुजारने में. Now 65-year-old, multiple well-defined soft tissue opacities. What is your answer?
D.
Huh?
D.
What primary is she most likely to have? Lymphoma, melanoma, ovarian carcinoma and lung carcinoma. They can metastasize to the breast, is what you need to remember. All this can lead to vertebra plana, where the vertebral body has virtually got compressed, except you like to say osteogenic sarcoma. So you must know which involves intervertebral disc, which will not involve, between TB and metastasis very clearly. That's one more common question in the exam. Hypertension, renal impairment, multiple bilateral renal cysts. What is your answer?
B.
Autosomal dominant polycystic kidney disease. Curly B, curly A. What is the difference?
A.
A.
Basically, running from hilar area to periphery is the nature of curly A, is what you need to remember. So in radiology, once more, CHF signs on X-ray is a favorite topic. In mitral stenosis, left atrium enlarges. Enlargement of the left atrium is more a posteriorly progressing event or anteriorly progressing? Posteriorly. Between right and left chambers, which are anterior?
Right.
Right ventricle, right atrium are anterior. If they enlarge, what will happen? There will be retrosternal in place. Whereas when left chambers enlarge, they go more towards esophagus and posterior mediastinum, is what you need to understand. Okay, doc. Should be one confident answer for this quiz question. What is attached to posterior surface of ulna except? Some guesswork. Who is going to get that big clap? Let's see. What is your answer, Teja? Extempore. A. Teja's answer is abductor pollicis longus. Come on. D is one answer I am listening. Asha? B is what I am listening. Koi bolo C. Rupa is not proposing. So, who said B? Lucky boy to say B. Lucky. Asha to say B. B. One big clap, doctor. One big clap. Good. Guessing is all about entrance, doctor. So, extensor pollicis is attached to posterior surface of radius. It is not your mistake. But this could be a question. Now,
A.
hypertrophic pyloric stenosis, what you have is a projectile vomiting.
Projectile vomiting.
Simple question.
Yes.
Let's run along.
B.
Springs.
B.
B.
So hypertrophic plexuses is what you have. Medium risk for DVT is which one?
D.
Total hip replacement is not
High
the, it's a high risk. Now focused abdominal fast,
D.
basically it can't be able to make up if it is a penetrating trauma, and also if it is a hollow viscous.
C.
So 15%, doctor, 15% the loss of fluid produces the shock, 10 to 15% actually.
A.
Graft anatomy.
A.
So thicker grafts will have a greater amount of contracture is what need to be remembered. Once more, split thickness and full thickness, advantages, disadvantages, differences. Today evening only you should review. Salivary gland tumors, what do you like to say, doc? What is the more common presentation? They basically arise in the superficial lobe. They will be growing like a painless swelling below the ear, in front of the ear, or the upper aspect of the neck is a classical location. Is what you need to ultimately remember. Thromboangiitis, obliterans and cigarette smoking, what is your answer?
C.
It is usually a disorder below 40 years. Below 40 years is one of the important criteria. What is wrong about the hernias, doctor?
C.
So one question on hernia, very high yield topic. So elderly versus young people, you must know. Elderly people have a weaker abdominal wall. So greater chance of getting a direct inguinal hernia, unlike the
117, question number 117.
117. Okay, please give the mic, doctor. 117. Okay. Yeah.
What about option D?
117 you want to propose?
Option D.
Clinical examination reveals a diffuse firm swelling in the soft palate and tonsil, right? Is possible because salivary glands can be
Sir, soft palate, tonsil.
soft palate and tonsil. What was given? Soft palate and tonsil only, no? If it is a sublingual gland, sublingual salivary glands, then in those locations when the tumor occur in the minor salivary glands, it can lead to a diffuse firm swelling which can push the soft palate and tonsil. That's the idea. Now, doctor, Barrett's, what type of epithelium it is called? Metaplastic. Metaplastic, which is precancerous in nature, and esophagus carcinoma.
D.
What is the speciality of esophagus? It doesn't have a serosa. Any esophageal tumor diffusely spreads across the mediastinum. That's the reason always, what is the rule? Lymph node involvement definitely is a prognostic marker.
What about D, sir?
What about?
D.
Yeah, esophagus, the gullet will be able to accommodate, that's what? Dysphagia is not a, dysphagia is a late feature.
It is most common presenting symptom, sir.
Huh?
C. C.
Dysphagia is the most common presenting feature, but it is a late feature. Most of the times, if patient of dysphagia comes and you diagnose esophageal cancer, what is the only option left for you? To prepare him for preparing his legal will. But you diagnose him without dysphagia, a much early possibility that you are a very paranoid clinician, suspecting possibility of it. But ultimately dysphagia is the late presenting feature, unfortunately. All these can be precancerous, but not
Duodenal.
duodenal ulcer is not. Non-metastatic effect is, so what is Pausios? Superficial thrombophlebitis. Twice years is left supraclavicular lymphadenopathy. That is direct metastasis. Pausios is non-metastatic, otherwise called paraneoplastic manifestation is what need to be remembered. Hepatocellular carcinoma, what is the truth about the surgical approach, doctor?
D.
Basically adjuvant chemotherapy, unfortunately when you give, that liver toxicity is unbearable and so remarkable. So that's the reason it won't improve the prognosis, chemotherapy, adjuvant chemotherapy in case of liver cell cancer. Regarding anatomy of the spleen,
D.
very fundamental question.
Celiac.
From where will it arise?
Celiac.
Celiac axis, that's good. About gallstones, what do you want to say, doc?
B.
Huh?
B.
B. Though it is called colicky pain, It is not actually colicky. It is more often dull and constant. That is a misnomer about the gallstones colic. Now, hereditary pancreatitis.
D.
It very much carries a risk of leading to pancreatic cancer. Which part of the state, India, we have Kerala.
Kerala.
We have hereditary pancreatitis incidence high. Ulcerative colitis.
Smoking.
What is the wrong statement?
C.
Smoking in fact is found to be protective factor. Next week we will give some little more better questions, tougher questions. These are all became a routine questions for all of you. Not too big card 15.
Crohn's.
Basically is for Crohn's disease. Erythematous polyps. What is the wrong statement?
D. Bullous will go.
Tubular adenoma or Bullous? Which will
Bullous
cause?
Bullous.
Bullous adenoma. If you have any objections, raise them. Any other alternative you thought, and we have put any controversial option, let us debate about it. Otherwise I am assuming all of you are okay with our answers. Now, generics. Which events in the carcinogenesis of colon are early events, late events? You must be very clear. Colon cancer is a progression from that of a polyp towards malignancy. So what is your answer?
B.
APC mutations are the early event in the carcinogenic pathway. So I leave the literature for you to know which are late and early. All these are true. Prevent the additions.
D.
Avoiding covering of the anastomos and raw peritoneal surface is except about it. Thyroidectomy. In case of a colloid goiter, if you do a less ambitious surgery like subtotal resection, there is a greater chance of a recurrent tumor to grow. That's the reason you should not. So you must be sure where will you do total thyroidectomy, where will you do subtotal thyroidectomy when it comes to the various 4 types of malignancies. Today only you should read. Now, yeah?
C.
Option C. In young patients, yes, there is a greater chance of recurrence to occur if you do subtotal. That's the reason you will do a total thyroidectomy. In case of the young patients is what need to be remembered. Okay. Oh, I know why you thought why you thought C. Lifelong they need to take thyroxine. Without thyroidectomy also a lot of young people need to take thyroxine lifelong. Taking thyroxine is not a big deal, or taking multivitamin tablet, what is there to take? There is nothing to fear about it. What is wrong about thyroid swelling?
B.
D.
B.
D you want to say?
D for
B,
doctor.
B for beggar.
B, sir.
That's right. Even though they are encapsulated papillary carcinomas are malignant. There is nothing like papillary adenoma. Unlike in follicular carcinomas, there is a follicular adenoma. Right? Now, regarding breast cancer, what do you want to say, doc? Breast carcinoma?
B.
B. That's right. E. cadherin is the one which reacts with the lobular carcinoma. Once more, lobular and what is the other type? Ductal. Breast cancer, doctor. Oh, it's worth spending 1 to 2 hours and be ready with anything on breast cancer. If you take surgery, especially surgery is a ocean like topic. 30 questions will come in the actual entrance. Somebody is having that list, hit list, Tehelka list. What is commonly asked? Highest I believe is thyroid cancer. Just check that, doctor.
Breast cancer and thyroid cancer.
Breast cancer, thyroid cancer. From breakfast upma to lunch sambar is over. Then prostate cancer,
Salivary gland tumors. Salivary gland tumors.
Salivary gland. You will think salivary gland tumors is a kutti useless topic. No, doctor. If you take 75 times previous All India IIMS PGI, 60 plus times it has been asked. Then you will get up for a cup of tea in the reading room. Then carcinoma colon, gallstones, peptic ulcer, Bilrod type 1, Bilrod type 2, all the tea that you have taken will not show any effect. By the time evening 5 p.m. you are done with the top 10 topics. You will go for a walk, you will have a talk, you will also once more check whether you lost the leftover part of sanity in the brain, then you will sit to finish the remaining 10 topics. First day 20 topics, maximum 4 days, finish 80 topics. Don't read beyond it, throw away Bailey and Love. 30 questions will come from this 80, that is the rule. Unless you are ready with that list like a menu, you finish and don't be ambitious to read everything, that is not meant for it. I might have given 125 topics in the list, but don't go through all 125, you will not get time. Remaining 45 you tell God, if I don't get seat next year I will read. Once more April शुरू होता है, March शुरू होता है, summer आ जाएगा, so that's the reason. Be sure the list is given. Those who didn't collect the list, doctor, please demand it, our center manager will give you. Now, etiology of renal calculi, what is your answer?
C.
You like to say C or B?
Sir, false, sir.
False. It is the decreased urinary citrate. Citrate normally will buffer calcium from precipitating. So decreased citrate will basically predispose to renal calculi.
C, sir. Then C.
Yes. You thought Proteus?
Yes.
No. Proteus are known to lead, but if you take overall, it is the urea splitting streptococci, staphylococci and Proteus, all of them. Now, Gravids tumor,
D, upper pole.
it is the upper pole where it is very common. Bladder cancer, the most common histology any day is urothelial. Urothelial, which is transitional. Only bilharziasis you have squamous cell type. Prostate surgical anatomy, you should know that it is the columnar epithelium, not transitional. What about D? Transurethral prostatectomy, you will be damaging the nervous plexus, which is important for the potence. That's the reason erectile dysfunction can occur as a consequence. Now doctor, medial side of the testis drain into?
B.
Into the node at the bifurcation of the common iliac artery, classical location for the drainage. Last 10 questions we will discuss before calling this wonderful evening with all of you. And once more Sunday we have another mock test, and next 2 days read full energy. Thursday, Friday, Saturday. Come back on Sunday, we will once more fight on Sunday. And tomorrow, day after tomorrow, we have a forensic session in the evening. Please come. We will love to see you all. And on Saturday, we have pathology. Sunday, we will have a mock test. So now, Dr. Ricketts, what is wrong about it? Proliferative zone is active. It is not inactive. Unicameral bone cyst is more likely on
Proximal.
upper humerus, not distal humerus of the distal humerus. Then osteogenic sarcoma, what do you like to say, doc?
C.
Pathological, what is more common? Pathological fracture is rare. Pain is usually the first symptom. When there is antry instability, what are the important movements? So anterior dislocation of the shoulder, posterior dislocation of the hip. They both are your good friends. Don't forget their attitude. Common question. It is the abduction, external rotation and extension is what you have to ultimately remember. Most common skeletal TB will be?
Spine.
Absolutely. What is wrong about CDH? CDH. Lot of people wrongly think late walking is a feature. A child with CDH can walk normally, but there is a small
Waddling gait.
waddling gait will be there. That is also fine. Most of the children can walk by 12, even with CDH. But if any child doesn't walk beyond 15, suspect CDH. That is different from the statement number 4. Now, a vascular necrosis as a complication, what is accept?
B. Proximal.
It is the proximal part of the scaphoid. Supracondylar fracture, another very high yield topic in ortho.
A.
Ortho is another topic. Subject only top 20 topics, don't read beyond it in the list given to you. First topic only will consume half of your day. Bone tumors. Most high yield topic, all bone tumors which will come from epiphysis, metaphysis, what age group, male or female, diaphysis, which will calcify, which will not calcify, everything you must read. Okay doctor, supracondylar fracture, it is displaced posteriorly. Jefferson's fracture, what is the specialty doctor? In Jefferson's fracture, the space is sufficiently enough that it will not lead to compromise of the neural canal, is what you have to ultimately remember. Remaining things are true, that it is a bursting force, sudden severe load on the top of the head, anything can basically, open mouth view is a very common question. So the last question for the evening, posterior dislocation, what is accept doc?
A.
Beautiful. How is the leg doctor attitude? Short, but it is adducted, internally rotated, slightly flexed. Is a classical attitude. What was given?
False accept.
Oh, very bad. That is, we are obsessive. That accept should be removed. Thank you very much, and we'll see you. Remaining questions, run through explanation. Just I was short of time. Yeah.